Imagine you're, waking up again with that familiar grinding ache. You are seeking relief for a chronic condition, maybe it's knee osteoarthritis,
Mhm.
and you finally reach the point where you're seriously considering leaving the country for regenerative medicine. So you open your laptop, you start searching, and immediately you're hit with just like a barrage of targeted ads.
Oh, the marketing is relentless.
It's everywhere. And the massive looming question seems to be, do you go to Mexico or do you go to Thailand?
Right, a classic debate.
Right. So we're jumping straight into a comprehensive 2026 report from STEMCIERGE today. It's titled Mexico versus Thailand Stem Cell Therapy, Cost and Safety. And our mission is really to cut right through all that marketing noise.
Which is so needed right now.
Definitely.
Welcome to STEMCIERGE, your global concierge for advanced regenerative medicine. Here, we explore the science and breakthroughs redefining longevity and human performance, giving you clarity, confidence, and trusted insights as you navigate stem cell therapy around the world. Let's begin our deep dive.
We're going to break down the real practical differences between these two global hubs and give you, the listener, a framework to make an informed medical decision.
Yeah.
Because looking at this data, choosing a stem cell therapy based just on the country is, well, it's a lot like choosing a restaurant based solely on what city it's in.
Oh, that's a great way to put it.
Yeah, like the zip code doesn't guarantee the quality of the chef, and it certainly doesn't guarantee the ingredients.
What's fascinating here is that the source material immediately takes that initial question, Mexico or Thailand, and just turns it completely upside down.
How so?
Well, the question you should be asking isn't geographic at all. It's which specific medical proposal offers the strongest clinical rationale, the tightest safety controls, and the most logistical realism for my specific condition.
Right.
We get so caught up in the exotic geography of medical tourism that we completely forget we're fundamentally shopping for a complex, highly variable biological procedure.
Not a vacation destination.
Exactly, not a vacation.
Okay, let's unpack this. I hear you on the clinical rationale, but let's be real for a second.
Sure.
Whenever we talk about traveling for a medical procedure, the very first thing everyone wants to know is the price tag.
Always.
The baseline assumption for anyone leaving the US, Canada, or Australia is that they're doing it to save a mountain of cash. So what does this all actually mean for the wallet?
It is the most common assumption out there, absolutely. But the data from STEMCIERGE's 2026 global pricing research reveals a surprisingly different reality.
Okay.
The prices between these two countries actually overlap heavily. You don't have this massive, clean divide where, Mexico is the budget option and Thailand has the luxury option, or vice versa.
Yeah, the actual numbers in the report are pretty eye-opening. Like for a single knee treatment, you're looking at around $3,500 in Mexico. But in Thailand, that exact same single knee treatment ranges from $2,400 to $6,700.
Right.
And if you're looking at broader, more comprehensive stem cell programs in either country, the range is wild. I mean, anywhere from $3,000 to over $30,000.
It's a huge spread.
It is. Now, compare that to the U.S., where a bone marrow-based procedure runs about $3,500 to $8,000 per knee. If a clinical quote in Thailand is, say, $2,000 cheaper than getting it done in the U.S., I'm looking at my bank account thinking that's an automatic win. Why isn't it?
Because you're only looking at the clinical quote, right? You're not looking at the total treatment cost.
Oh.
This is where international patients get trapped constantly. The absolute cheapest clinic on paper is rarely the cheapest treatment when reality sets in.
Because of the travel.
Exactly. Think about the mechanics of a trip to Thailand from the United States. You're paying for long-haul flights. You're paying for accommodation for potentially weeks.
Oh, right. Hotels, food.
Yeah. And you have to factor in the lost wages from time away from work.
Yeah.
And do you need a caregiver to travel with you?
That's true. Someone to help you navigate a foreign city while you're recovering.
Right. What about their flight and their food? And most crucially, what if you need a return visit for follow-up care?
Oh, wow. Yeah.
Suddenly, that $2,000 you, quote-unquote, saved on the actual injection is entirely wiped out by a single round-trip plane ticket.
So you aren't just buying a vial of cells. You're buying the entire logistical infrastructure of getting there, staying there, and getting back.
Precisely. And that logistical infrastructure dictates who should travel where heavily based on their specific health condition.
Right, which makes sense.
This is where Mexico holds a massive logistical advantage for patients coming from North America.
Mm.
It's all about geographic access.
Hold on, let me push back on that a little.
Sure, go ahead.
If I'm flying out of the country because my knees are bone on bone and I'm in chronic pain, wouldn't I actively want to endure a 20-hour flight if it meant getting into a world-class multidisciplinary hospital in Thailand?
I see what you're saying.
Like, why does a short flight to Mexico matter so much if the ultimate goal is getting the best possible care?
Because of how the human body physically responds to air travel, especially right after a medical procedure.
Okay, tell me more about that.
If you're dealing with chronic pain, impaired mobility, or, say, a neurological condition, sitting on a plane for 20 hours is not just an inconvenience. It chemically and structurally exacerbates your condition.
Wait, really? Just the flight itself?
Absolutely. Think about the changes in cabin pressure, the pooling of blood in your lower extremities, the risk of deep vein thrombosis,
Oh, right.
and just the sheer physical stress of navigating airports. If you just had a highly sensitive experimental biological agent injected into a joint,
Right.
and then you subject that joint to a massive spike in systemic inflammation from a long-haul flight, you can actively destroy the very cells you just paid thousands of dollars to receive.
Ah, I see. You could get the most advanced therapy on Earth, but dragging a freshly treated inflamed knee through 4 different airport terminals in a 40-hour layover,
Exactly.
it just ruins the environment those cells need to survive.
That's the core issue. The best stem cells in the world do not matter if the travel required to get them destroys your body's ability to heal.
That is such a crucial point.
Continuity of care is a massive factor.
Yeah.
Mexico allows a patient to fly in, get treated, and fly home quickly to recover in their own bed before massive inflammation sets in.
Right.
It also means follow-up visits are just a quick hop over the border.
I like to think of it as a choice between a targeted strike and a holistic retreat.
I like that.
Yeah, Mexico is the targeted strike. Get in, get treated, get home. But the report highlights that Thailand offers something completely different.
It does.
Its advantage lies in longer, coordinated, multidisciplinary programs.
If we connect this to the bigger picture, Thailand makes an enormous amount of sense if your needs go far beyond a single, isolated injection.
Like what kind of needs?
Let's say you need what is called a tertiary care ecosystem. That means you don't just need a doctor. You need hospital-based specialists, advanced diagnostic imaging like highly specialized MRIs,
Okay.
and integrated physical rehabilitation, all coordinated under one roof by a team of experts communicating with each other.
Oh, wow. So a full team.
Yes. Thailand's medical infrastructure, particularly in Bangkok, is highly developed for that level of comprehensive, weeks-long care. It's also, obviously, the primary choice if you're already based in the Asia-Pacific region or the Middle East.
Okay, so let's say I've evaluated my logistics. I decide I need the targeted strike.
Right.
I book my short flight to Mexico to save my knees. I arrive at the clinic. I walk in the front door, and they have a giant, shiny, beautifully framed government license on the wall.
Right.
At that point, I should feel 100% safe, right? I mean, the government signed off on it.
That is one of the most dangerous mirages in medical tourism.
A mirage.
Yes. Both countries have regulatory frameworks. Thailand uses the Thai Food and Drug Administration's ATMP framework, which stands for Advanced Therapy Medicinal Products.
Okay, ATMP.
And Mexico operates under COFEPRIS, their federal health risk regulator. But here's the trap. A licensed facility does not mean a specific experimental stem cell treatment is an approved medicinal product for your specific condition.
Wait, I really need to understand this. If a clinic waves a piece of paper saying they are COFEPRIS authorized or Thai FDA licensed, what does that actually mean if it doesn't mean the treatment works?
It might simply mean the physical building is up to code.
Just the building.
Yeah, or it might mean they have authorization to operate a tissue bank, which are essentially high-tech refrigerators.
Yeah.
Or it means they're allowed to conduct general laboratory activities.
That is wild.
It absolutely does not mean the government has run clinical trials and validated their specific protocol for treating your multiple sclerosis or your osteoarthritis.
Wow.
You have to verify regulation at the level of the laboratory, the product, and the procedure, not just at the level of the clinic's front door.
That is terrifyingly vague. And it brings up the safety aspect, which the report hits head on.
Yes, it does.
It details a 2024 CDC investigation where 3 U.S. patients developed difficult-to-treat Mycobacterium abscessus infections.
Right.
And those infections came from clinics in Mexico.
It is a sobering detail. Mycobacterium abscessus is a rapidly growing, non-tuberculous mycobacterium that is incredibly stubborn,
Like resistant to antibiotics?
very resistant to many antibiotics.
Yeah.
It usually shows up when water or equipment isn't perfectly sterile. But the lesson the report draws from that CDC investigation is vital.
What's the lesson?
That outbreak isn't proof that Mexico as an entire country is unsafe for stem cell therapy. Contamination risks exist everywhere on the planet.
Right.
What that outbreak proves is that laboratory sterility, traceability, and the manufacturing standards of the cells matter immensely.
I try to picture it like manufacturing microchips rather than just washing dishes in a restaurant kitchen.
That's a perfect analogy.
Like a single microscopic speck of dust or bacteria can ruin the entire batch.
Exactly. A bacterial infection points to a severe breakdown in laboratory protocols, not a flaw in the country's geography. Safety is always verified at the level of the lab.
Which brings us to the actual science. If a government stamp on the wall doesn't guarantee the treatment works, and the clinic's marketing is just noise, how on earth does a patient actually evaluate the science? Where is the real evidence?
Just a quick break. This episode is brought to you by STEMCIERGE. If you're exploring stem cell therapy or evaluating clinics around the world, visit STEMCIERGE.com and take the free quiz to receive your personalized assessment. You'll get expert feedback on your eligibility, treatment options, and potential destinations, empowering you to make informed, confident decisions in the world of regenerative medicine. Visit STEMCIERGE.com today. Now, back to the episode.
The evidence varies wildly depending on what you're trying to treat, which is why a blanket stem cells work statement is so misleading.
Makes sense.
Let's look at knee osteoarthritis, which is one of the better studied applications. The report cites a 2025 Cochrane review. Now, a Cochrane review is essentially the gold standard in evidence-based medicine.
Right, they pool everything together.
Exactly. It's a rigorous, independent analysis that pools together all existing data, not just one cherry-picked study from a clinic's website.
And what did that gold standard review actually find?
It found that stem cell injections may slightly improve pain and function for knee osteoarthritis, but they rated the certainty of that evidence as low.
Low certainty, meaning what exactly?
Meaning the results are highly variable from patient to patient. However, contrast that with a 2026 meta-analysis looking at 24 randomized trials with almost 1,400 patients.
Okay.
That analysis showed much clearer, more consistent improvements, specifically for cartilage defects.
Wait, why the difference? Why would a cartilage defect respond better than general arthritis?
Because a cartilage defect is often a localized, specific injury in an otherwise relatively healthy joint environment.
Oh, I see.
General osteoarthritis is a systemic, highly inflammatory disease state that affects the entire joint capsule. Dropping stem cells into a highly toxic, inflamed environment is very different than placing them into a localized defect. The science is incredibly nuanced.
But the marketing completely ignores that nuance. You see clinics constantly boasting about their raw numbers, like, come to us, we'll give you 50 million cells.
Oh, yeah.
No, fly to our clinic, we'll give you 100 million cells. It feels like a biological arms race.
It is, and it's a dangerous one. The report makes it very clear that higher cell counts absolutely do not equal better results. The raw number of cells is practically meaningless without context.
It's like megapixels on a digital camera.
Right.
You could have a camera with 1 billion megapixels, but if you put them behind a cheap plastic scratched lens, you're still going to take a terrible photograph. The raw number doesn't fix the underlying mechanism.
What matters is the cell identity. What matters is their viability.
Wait, viability meaning, are they actually alive? Are clinics injecting dead cells?
If the laboratory processing is poor, or if the cells are shipped improperly, yes. And this is critical because of how your body reacts.
How so?
If a clinic injects 50 million dead cells into your knee, your body doesn't just absorb them peacefully. Your immune system recognizes them as cellular garbage.
Oh.
It mounts an attack, triggering massive, painful inflammation, which is the exact opposite of the healing response you paid for.
That is wild.
Furthermore, you have to look at the manufacturing process. Are the cells culture expanded?
I see that term all the time in these brochures. What does culture expanded actually mean? Are they just growing them in a petri dish?
Essentially, yes. They take a small sample of cells and feed them in a lab so they multiply into the tens of millions.
Okay.
But multiplying cells introduces immense risk, if not done perfectly. Every time a cell divides outside the human body, there's a risk of genetic mutation, not to mention the risk of bacterial contamination we discussed earlier.
Right, the sterility issue.
You need highly specialized, highly regulated labs to do this safely. So the clinical rationale for the dose matters infinitely more than just shouting 100 million cells.
It sounds like I'm playing Russian roulette if I just look at cell counts and government licenses. There has to be a triage system here. What should you actually be looking at first?
Well, STEMCIERGE provides a very specific framework for making this decision. It's an actual order of operations, and you do not start with the country.
Okay, what is the order?
The decision order should be diagnosis first, then the physician, then the treatment rationale.
Got it.
After that, look at the cell product, then the laboratory, then the evidence, then the regulation, then the follow-up plan, then travel. And finally, cost is at the very bottom of the list.
It forces you to build a rock-solid foundation of medical credibility before you even look at a flight price.
Exactly.
If the physician isn't qualified or the laboratory won't share its sterility protocols, it doesn't matter if the flight is cheap.
Precisely. The medical fundamentals have to be bulletproof first.
And the absolute best part of this report is that it highlights that you don't have to navigate this incredibly complex maze alone.
No, you don't.
The source material points out that STEMCIERGE actually offers a concierge service specifically designed to help international patients figure this out. They help direct you to vetted clinics, they check your eligibility, and you can get a personalized candidate profile in just 3 minutes.
It's a great tool.
It really is. It's entirely confidential, and you don't even need any medical documentation to get started with the assessment. It's just a massive shortcut to cutting through the marketing hype and getting straight to the science. If you are even considering this route, you need to go to STEMCIERGE and get that profile.
This raises an important question, really, about taking control of your own patient journey.
Yeah.
When you use a service like STEMCIERGE to find a clinic, or even if you're evaluating one on your own, you need tools to test that clinic's credibility directly. STEMCIERGE provides a list of 10 crucial questions every patient must ask before handing over a deposit.
What are the big ones?
Where do the cells come from? Are they autologous, meaning from your own body, or donor-derived?
Okay, that's important.
Are they culture expanded? What viable dose will actually be administered? And my personal favorite, which almost no one asks, what is the follow-up plan after I return home?
I love that last one. If a clinic gives you a vague answer to any of these, like if they dodge the question about where the cells come from, or they hide behind proprietary jargon when you ask about culture expansion,
Right.
or they just shrug when you ask what happens if you get an infection 3 weeks after you fly home, you walk away, period.
100%.
If they cannot explain the science clearly and transparently, you do not let them inject anything into your body.
The ability to communicate the science clearly is a key indicator of a clinic's medical integrity. Transparency is your greatest shield against bad medicine.
So what does this all mean? If we are synthesizing everything we've pulled from this deep dive, the main takeaway for you, the listener, is that you have to stop comparing Mexico and Thailand as if they're giant singular hospitals.
They aren't.
Instead, you need to compare the specific doctor who will be treating you, compare the laboratory processing the cells, compare the clinical evidence backing their specific protocol, and compare their follow-up plan for when you're back in your own living room. And remember, go straight to STEMCIERGE to get your personalized candidate profile and use those 10 vital questions to vet any international clinic.
And if you find a medical proposal that withstands all of that intense scrutiny, only then do you look at the map and decide if the travel logistics make sense for your body and your bank account.
Absolutely.
Thank you for listening. If you found this episode valuable, please leave us a 5-star rating and review, then share it with someone who may benefit from it. For global insights and personalized guidance on stem cell therapy, visit STEMCIERGE.com to receive your tailored assessment and explore your treatment options with clarity and confidence. And as always, remember, this podcast is for educational purposes only and is not a substitute for professional medical advice. Please consult your doctor before making decisions about your health. Until next time, stay informed, stay empowered with STEMCIERGE.com.